morning. My name is Dr. Anjana and I'm the Managing Director at Dr. Mohan's Diabetes Specialty Center. Happy Yoga Day to all you folks out there. You may ask how yoga is related to diabetes and why a diabetologist should talk about yoga. Do we have any evidence to show that yoga is linked to diabetes? Is there any beneficial effect of doing yoga for patients with diabetes? Now let's look at these in a little bit of detail. Yoga is an ancient science that links the body with the mind. Now, if you look at all metabolic diseases like diabetes, obesity, hypertension, you'll see that there are connections between the body and the mind. So if you take a person with diabetes, what are the pillars for control of diabetes? A good diet, physical activity, taking your medicines, regular checkup. But for someone who does all of these, they may still have difficulty in controlling their glucose levels due to very high stress. Now, what does stress do? Stress is a killer overall, affects everything from head to toe. Diabetes is no exception. So if you look at the link between diabetes and stress, you will see that yoga has a very, very important component here. We've done some studies that have looked at patients with type 2 diabetes. This was done with the Ayush. It was a research project in which we took patients with diabetes and saw whether doing yoga along with their blood sugar medicines was beneficial for these patients. What we found is that this was a randomized controlled trial of about 150 individuals. And what we found is that in both men and women, yoga had a very good effect on the stress reduction part. Did it bring the glucose levels down? Yes, it did bring down the glucose levels before and after the 17 weeks that we did the weekly yoga intervention. But it was not significantly different from control. So did it have an independent effect on bringing down the glucose levels? No, it did not. But what it did is that it improved the ability to bring down stress, anxiety, depression, and improved cognition and mindfulness. Now, these are all very, very important elements for someone with diabetes. The anxiety and stress component that you have with diabetes is a real thing. This is more for women than it is for men. So having this additional yoga component for someone with diabetes gives the additional benefit. So what does it do in terms of the benefit? What are these yogic asanas and things that we should do? Here's what we did in the trial. We started with a small meditation. So we have the dhyana component. We have the asana component. So asanas are the various postures. There are different types of asanas. The ICMR actually has a set routine that you can do for people with diabetes. These are various postures that help in flexibility, movement. It helps to increase your heart rate, etc. So that's the asana component. That's the main component. But before and after, you have the pranayama and the dhyana component as well. Pranayama means just the breathing component, and this is the primary one that is related to anxiety and stress. The asanas help with the actual burning of the glucose, muscle strength, etc. And the dhyana is the meditation, mindfulness component. Now, can yoga be used to prevent diabetes or help to improve fitness, anxiety, all of that? For this, we went to children. These were 13 to 15-year-old children. We studied 2,000 of them as part of what we call the Yoga Diab study. This was an ICMR sponsored study which was done in Chennai and Delhi. We did the 1,000 children in Chennai and 1,000 children in Delhi, from 2,000 children for 24 schools. What did we do? We went to the schools and gave weekly yoga classes. Each class was for about 45 minutes. This is akin to the PT period that you have. So we did weekly once. We did that for 4 months with one extra class. So totally 17 classes we gave these children. And remember, they're all in the pubertal ages now, so boys and girls. And what did we find? we found tremendous reductions in stress. So these children, how did we measure the stress? It's not just what they felt and what they told us, which also we have through questionnaires, but we were able to actually measure the body stress in these children through salivary cortisol. So this is easy to measure, and we were actually able to measure this in the children. Now, this is a very critical age group for memory, cognition, for remembering things, writing exams. So we found yoga had a tremendous effect in that particular category for these children. So we have this thing called as letter cancellation test. It's a small little test where you do, it's a measure of cognition actually. Memory, cognition, all this improved so much for the children who did the yoga. Again, this was a randomized controlled trial. So what we show is that it helps in memory, improvement of memory, cognition, understanding, your clarity of thought, your mindfulness improves, your stress decreases. And I think these help children perform better. Also, what we saw is that in these children, they did lose some weight. Not a lot. These are growing children, so you don't expect them to lose too much weight, about 1 kilo or so. But what was most important is that they lost a lot of body fat, their blood pressure came down, resting heart rate come down. So these are all signs of fitness in a child, and these are things that can translate into long-term risk of non-communicable diseases like obesity, diabetes, hypertension, etc. So in the prevention stage, we're able to show that yoga had such a tremendous effect on children, and that's where I think we should focus all our energy. Our children nowadays are going through extreme stress, are getting rather obese, and are getting the risk for metabolic disease. So here's where we should put in we have now evidence to show that it really works. What did we do? Again, pretty easy to do in school. We start with, again, the pranayama meditation part, the pranayama part. This is then followed by the asanas. Here we did a lot of Surya Namaskar in these children. It's very standard, it's very simple, easy to do, and hence that was easily accepted. We did have some others also, other asanas along with that. So that's the split between the adult yoga component and the child yoga component. The children part is useful for prevention of diabetes. In adults with diabetes, it helps to control the glucose levels. So people often ask me, doctor, do you do any yoga? I do. As a matter of fact, my dad used to say this earlier. So my dad, Professor V. Mohan, used to say yoga. When I was a child itself, he started talking about yoga and said, you must do yoga. It helps you so much. It will control your stress, make you calm and all. I never used to believe him. I was a teenager at that time, and I just didn't believe him. But slowly as I grew, I realized the value of what he was saying, because I can feel that difference. I only do the pranayama bit because I do other exercises outside of this. So I use the pranayama bit, which works on the calming of the mind, the stress reduction. And 10 minutes of yoga a day keeps you absolutely calm, keeps your mind in control, decreases the stress. For someone like me who's constantly making decisions day after day, it helps to make the right decisions and overall maintain a positive outlook. Yoga has one more use, and for me personally, where do I use the asanas and things? I do that when I travel. So sometimes when you travel to different corners of the country or outside, we may or may not have access to a gym to do your regular workouts. Here's where we have the Surya Namaskar that absolutely comes into play, where it's easy to do wherever you're staying. You can do it in your own room. You can use this routine as something that is aerobic. You can use it for strength training, depends on how fast you do it, depends on the number of times, the repetitions, the way in which it's done, etc. So all of these, I can't tell you, yoga is just a very complete routine. You could have aerobic component, you could have the flexibility, you could have the strength, and in addition, you also end up having the stress reduction. So happy Yoga Day to everyone.